Hello friends and my dear students. I'm back with a new lecture, and today we are going to talk about two very important concepts. The concepts of illness and sickness. These two concepts are situated in the trajectory between disease and treatment, or you can say medicine. Right? Sometimes we also talk about medical care and healthcare, but yes, we know that there is difference between medical care and healthcare, and for that matter, medicine and medical care. So we'll talk about those things at a later stage. But as of now, we are just saying that that the notions of illness and sickness are situated between the conditions of disease and seeking treatment, right? Seeking treatment or some kind of medicine, right? So these two concepts are very sociological, and actually even the biomedical sciences or medical sciences, they need to understand these notions of illness and sickness. And yes, sociologists have been playing very important role. And that is why medical sociology came into existence, almost 50 years back, because they play very, very important role, because somehow these things are located in social situations. I can make you understand this by giving some practical examples. For example, in every country, or for that matter, any society, we see that uh, not every person is responding same way when he or she is suffering from some kind of disease, right? So the occurrence of disease is creating certain conditions, but responses to those conditions are not the same. So those responses are varying, and even the outcome or the consequences are varying. So what are those situations or conditions which create those differences? Why do we have different outcomes in different specific context? Or you can say that why do different social categories of people have different outcomes when they are exposed to the similar kinds of problems and they are administered with the similar kind of intervention, or you can say medicine? What I'm intending to say here, or what I'm saying here, is this: that maybe two persons who are suffering from same kind of problem, right? Same kind of disease, and they are administered with the same kind of medicine also. But the responses will vary from person to person and from context to context, culture to culture, society to society. So why such things keep on happening? We will try to understand these things. That's why we are saying that all these things are situated within the notions of illness and sickness. These are the subjective uh, considerations, subjective state of minds. And then what are the differences between these? What are the basic differences between these two concepts, illness and sicknesses, is something that we are also going to talk about. And then there are several illness behavior related concepts. We are also going to talk about those things. So yes, I'm going to share my screen because I have some slides. And yes, it takes little time. Yes, I got it. Right. So here is the slide, and the topic is illness, sickness, and illness behavior, from disease to medicine or medical care. Now, I have depicted the things by making use of some symbols, although I'm very poor in creating those symbols. But yes, if this is the condition, extreme left, we can see this disease. And then the right, we can see this is medicine. So in between disease and medicine, these concepts are located. One is illness, another is sickness, and then illness behavior. In illness behavior, we have included few things like illness action, illness behavior, illness narrative, illness doubt. And yes, some of these things are situated just here, closer to the illness concept, and some may be closer to the sickness concept. When we will understand these things, we will understand those things. This is just simply a symbolic representation, right? And this lecture is divided in 3 parts. Why do we need to understand the notion of illness and sickness? And how are they different from the notions of disease? Then what do we understand by the concept of illness behavior, illness action, illness narrative, and illness doubt? And the last part is, what are the theoretical perspective to understand the states of illness and sickness? As I stated, these are outrightly out and out sociological concepts. And we know that in sociology, there are several sociological perspectives. So how do these perspectives examine this situation? Do they examine in totality, or what are the differences? We'll talk about that if time allows us, right? So now we come here with the topic illness. So we'll have this definition first. By illness, we mean a subjective phenomenon in which individuals perceive themselves as not feeling well, and therefore may tend to modify their normal behavior, right? Here, Hooker-Ham and Ritchie talk about 2 conditions. I've highlighted them. One is the subjective phenomenon in which individuals perceive themselves as not feeling well. So when there is some problem, I have already mentioned that when there is a condition of disease, only after that, this condition of illness is coming into existence. But the problem is this, that disease needs some kind of confirmation, right? The moment somebody is witnessing or realizing some kind of pain or suffering or some problem, automatically it cannot get identified as disease. Yesterday or in the previous class, we talked about disease. And there we stated that disease needs confirmation, recognition, because unless those, whatever symptoms are there, unless those symptoms are matched with the existing knowledge and something is confirmed, nobody can declare that particular condition as the condition of disease. If you have not watched that lecture, then I suggest you to go and watch that lecture, because we need to understand what is disease and under which conditions disease operate. Because unless we understand thoroughly the concept of disease and health, we cannot. So there is another lecture on health. I suggest you to go through those lectures before going through this one, right? So the condition of disease is there. Some problems are there, right? And the person who is witnessing those problems is having some kind of subjective understanding, is not feeling well, is realizing, he or she is realizing that something is not going well within him or her. So that thing is there. And the second important thing is this, that because when someone is having this kind of feeling, then there may be 2 things. He or she may think of this and then discard this. Okay, fine, there's no problem. If he or she is discarding that, then at that point of time, it's over. But when this person is thinking that, no, there is some problem and I need to do something, that means may tend to modify their normal behavior at that point of time. So these 2 things, when these 2 things take place simultaneously, some kind of problem is realized and the person is actually making himself or herself mentally prepared for doing something in response to that, then that condition is known as the condition of illness, right? Then illness refers to the social and lived experiences of symptoms and sufferings which are innately human. So the sufferings or the ailment or the problem is human, but there is a manifestation of those symptoms, right? And those manifestations are actually lived experiences, and that is why those are the social conditions. But the person needs to realize and recognize. It includes recognizing that bodily processes are malfunctioning and taking steps to rectify the situation, such as seeking treatment. So if that person is not able to recognize those alterations which are taking place, then the state of illness cannot come into existence, because that subjective understanding or awareness is a necessary condition. So very often what happens that people may have those symptoms, but they are not subjectively aware of those things, right? So sometimes it happens that some cut we experience, but if we are not aware of, then we don't realize that there is a pain. But at some stage, when we realize that there is a pain, and then we see that, oh, there is cut, and then only the whole everything related that an anxiety or that situation is coming into existence. Or I can give a better example, because these days everybody is talking about COVID-19, and we know that there are asymptomatic conditions also. So when somebody is asymptomatic, then even if he is suffering from, even if he is having that disease, and if suddenly or accidentally some kind of testing is taking place, then he or she will come out as COVID positive. But because the person is not aware of that, or because the person is not witnessing any kind of suffering or ailment, so he or she is not realizing that he or she is ill, right? So even if the bacteria or the virus or the pathogen or the organism is present or is creating some kind of problem, but if the person is not subjectively aware of this, then this is not the state of illness. And even if somebody is aware of, but if he or she is not taking a decision to seek treatment or to make some kind of alteration or make some kind of a correction in the behavior, then he is not moving in the direction of treatment, right? So we have understood the notion of illness elaborately. Now comes the another concept, that is the concept of sickness. Before that, Nettleton, according to Nettleton, the study of illness throws light on the nature of the interaction between the body, the individual, and society. This is very important, basically, because the disease is actually creating conditions in the body. And then the individual is coming in between, because society is yet to be informed about the conditions occurring in the body of the individual, right? So when the society is getting informed about this, this condition is known as sickness, right? So here is the concept of sickness. A major distinction in this regard is made between illness and sickness. Illness refers to individual, private, and usually biological aspect of state. The actual level of illness largely is similar from society to society, reflecting primarily biological nature of illness, but its manifestation or social expression may vary. Sickness refers to the public or social component of ill health. Illness is transformed into sickness when the condition becomes publicly known through announcement by the affected party, observation by significant others, or professional diagnosis. So an individual is feeling ill, then he is or she is making an announcement, and as a response to that announcement, some other agencies are getting activated, and then the society basically is recognizing that yes, such and such person is witnessing such and such problem. So when this information is actually accepted by the society, then the state of illness is getting converted into the state of sickness. Now a person is witnessing some kind of ailment, he or she is having some kind of subjective realization, he or she is reporting the matter, and then other agencies are actually taking cognizance of that, recognizing that, acknowledging that, and then after this acknowledgement or recognition, the matter is reported to some other agencies, and then only the treatment or the medical processes could start, or the medicinal processes could start, right? If the matter is not reported, or if the matter is not observed by significant others, I mean the near and dear one, all those persons who are living in proximity with the person, if they are unable to observe that, or for that matter, if there is no professional diagnosis, then even if the person is having the problem, or even if he is subjectively aware of that, but if it is not recognized by the society, this is not getting converted into the state of sickness. Now see, these are very nuanced stage. These are very nuanced states. We need to understand, because this is something which will direct all other processes and basically states of seeking healthcare. I may repeat some of these things because this needs to be clarified very well. Let me have just repetition. An individual, as we have expressed here, there is a condition of disease, then the person who is witnessing those conditions is actually realizing. This is a subjective realization. So he or she, after that subjective realization, decides that some kind of alteration is required, some kind of modification is required, some kind of treatment is required. So for seeking this treatment or some kind of support, he or she is actually getting involved in some kind of illness behavior. That may be different types of illness behavior. We will come to this thing, but basically he is reporting the matter, and once this is accepted by other agencies, it may be a doctor, it may be family members, it may be friends, it may be other observers, it can be anybody, right? Once it is recorded, then this matter is reported to other situations, or maybe it's not that the moment somebody is recognized as sick, that the treatment process will start. No, this depends upon several other factors: affordability, availability, accessibility, all those things are there. We are not talking about. We are saying that even before, even if there are ideal conditions are available, but unless someone is moving from this state of illness to a state of sickness, the process of seeking treatment cannot start, because so many things happen in between. Now, I hope that the things are clear, and you can go through these slides also for a better understanding. The concluding part is written here. Thus, while illness is primarily a biological state, sickness is a social state. Illness is individualized, so largely it is biological, but it's not absolutely biological, because of the presence of disease, we are considering this biological, but some kind of self-consciousness and self-awareness is involved here. So it is biological as well as psychological, or you can say it is a socio-psychological state, right? And from here, it moves to this sickness, which is out and out as social conditioning. Sickness is social not only because it is recognized beyond the bounds of the individual per se, but also because it has implications for social role performance and interpersonal interaction. So all those interpersonal interactions between the patient and the doctor, or maybe the patient and other family members, or maybe any other agency, is taking place only when there is a social recognition of that condition. Some simple example may help clarify the distinction between illness and sickness. We have already understood this. An individual who feels bad is clearly ill. However, if the individual never discloses his or her symptoms to others, or they go unobserved by others, and continues to perform social roles adequately, he or she, although ill, would not be considered sick. So sickness depends upon the condition under which someone discloses his or her symptoms, or the symptoms are observed by some other agency. It makes the state of sickness dependent upon the social conditions in which such disclosure or observation is taking place. Now you may ask, why do we talk about these things so extensively? Actually, the problem is immense in conversion of the state of illness to sickness. Because when we are talking about the approval of the society, then all social conditions are actually becoming applicable. The class situation, the caste situation, the ethnic background, the racial background, gender, income, and whatnot else. All these situations, all these conditions become, they get activated when these states or conditions are getting defined. So when an educated person is becoming ill, the responses may vary from the responses when an uneducated or less educated person is becoming ill, right? Or when an affluent person is becoming ill, the responses may vary from what are the responses which are witnessed by a poor person. That is why I'm saying all these social conditions, class, caste, religion, income, education, and what not else, all these things become applicable. Now, just a summary of illness, sickness, disease, and medicine. In contrast to illness, the term disease is defined as denoting a technical malfunction or deviation from the biological norm, which is scientifically diagnosed. Now, this is again very important. This scientifically diagnosed, we talked about this, yes, in the previous class, right? Then, however apparent their manifestations, these are hidden processes which can only be understood as their observable signs, which are related to a body of knowledge about the way in which the human organism works. See, let me give you some subtle examples here. In India, we see that the prevalence of chronic disease is very high. You know, very often when somebody is suffering from a problem like, say, cancer, right? We know that cancer is something which is a very serious complication and difficult. It is difficult to get it treated unless it is identified or discovered at an earlier stage. So whenever somebody is starting to witness some of the problems related to causation of cancer, then in initial stage, actually the symptoms are very subtle or very mild, right? So it is very difficult for a person to identify, recognize those alterations. But if someone is very cautious, careful, or even maybe accidentally, or maybe because of some of the other diagnosis, if somebody is becoming subjectively aware of the conditions related to causation of cancer, then the possibility of getting it treated is much better. And if somebody is unable to identify those symptoms or getting confused with some other symptoms, if unable to identify those symptoms or getting confused, then we say that the problem has already increased, and maybe the treatment or complete recovery is a difficult situation. So at what point of time the disease is getting identified and the process of treatment is starting, that is very important. And that is why the conditions related to illness and sicknesses are very important. Now let me give me one more example. Very often it happens that, see, gender discrimination is very much prevalent in many societies. And when, say, when a woman who is not enjoying high status in the family, when she is suffering from some kind of ailment or some problem, and when she is reporting the problem, it's not necessary that whatever she is reporting that may be acknowledged or that may be recognized. So if someone is not enjoying good status within the family or wherever he or she is, then maybe even if the person is suffering from some problem, this problem or this occurrence of the conditions of disease may not get converted into illness. That is one situation. And even if it is getting converted into illness, it may not get converted into the state of sickness. This is another situation. And if it is getting converted into sickness and it is being reported to the agencies who are responsible for providing medicine or healthcare, then again several interactions are taking place. We'll talk about illness narratives sort of thing, that other illness behavior related things are involved, right? So we are trying to understand all these intricate and interrelated conditions. Thus, understanding of disease depends upon observations of altered abnormal states of human organism. These signs may be objectively observed and even measurable, such as elevated body temperature or skin rash, or they may be subjective symptoms such as pain. So not all these conditions are objectively observable, right? So very often, as we go to a doctor, the doctor is asking, okay, tell us about your problems. So this reporting is very important. And this is the subjective component. Poor conceptualization of illness and sickness distracts and even destroys the discourses of treatment and healthcare. Now, as we stated, there are few other concepts also which are interrelated and which do influence the concept of illness and sickness. Now, David McCulloch is talking about illness behavior, right? Few things are written here. David McCulloch says that the concept of illness behavior in contrast describes the ways in which people respond to bodily indications and the conditions under which they come to view them as abnormal. Illness behavior is an important variable in medical sociology because not everyone responds the same way when realizing the abnormality. We just talked about that. How do people behave when they witness or realize the suffering or the pain? That is illness behavior. That's very important. Now, McCulloch and Foucault identify 4 dimensions of illness that influence the decision to seek medical help. When somebody is actually seeking medical care is not an automatic process. This is what we are talking about. Now here 4 conditions are identified. The frequency with which the illness occurs in a given population, then the familiarity of the symptoms. Now if person is not familiar with the symptoms, there are 2 possibilities. One possibility is that the person may immediately report to a health provider, and there is another possibility that he not at all refer to a healthcare provider. But these 2 conditions depend upon the social situation of that person. And then the predictability of the outcomes of the illness. What are the possible outcomes? And the 4th one is the amount of threat and loss that is likely to result from that particular illness. Then Kleinman talks about illness narrative. Now, narratives are actually the stories which are a reflection of the subjective experiences, right? So when a person who is suffering from some kind of illness or some kind of disease is narrating his or her experiences, right? When the person who is suffering from the problem is reporting the matter to someone, then this is illness narrative. Now, this illness narrative is very important because it's only through the illness narrative that the symptoms and the signs which are not objectively measurable are being reported. If this illness narrative is reported in a proper way, maybe the care or the treatment process may start in a proper way. And if illness narrative is not reported properly, then maybe the whole process is getting very adversely affected. So there are many people who have, this is an important research area as of today. And in sociology, we are having a symbolic interactionism perspective. And for those who are interested in symbolic interactionist perspective, these conditions are very important. That how do we report and how that is actually understood, right? There are so many barriers. There are cultural symbols. There are social conditions. Williams talks about narrative reconstruction, because when somebody is unable to tell the story in a proper way, then it becomes the responsibility of the agencies, or you can say the health providers, to recreate the story, right? Most of the time, the health providers have to reconstruct the story, and very often these are not reconstructed in a proper way. And when we are talking about chronic disease, or when we are talking about that, well, somebody was suffering from some problem, he went from one place to another place and conducted so many tests, but it could not work well, then maybe the story is not reported properly. Maybe the illness narrative is not expressed properly, or the story is not reconstructed properly. So from social construction point of view, this is very important. Then sociologists have therefore produced descriptions of the everyday situations of particular chronic disease, and in so doing have highlighted the biographical and cultural context in which illness emerges, right? So the biographical and cultural contexts are very important. I'm saying it time and again that the class situation, the cultural situation, the ethnographic situation, the linguistic problems, the spatial problem, and what not else. All these social conditions are playing very serious role in deciding, or this in conversion of this state to that state. I mean, from illness to sickness, or the production of illness behavior, or the production of narratives, or the narrative reconstruction. Now here I have introduced one concept that is again very important, and that is related to illness doubt, right? When an individual is actually producing the illness narrative, then production of this illness narrative is depending upon, again, the level of awareness of that particular person. You can say his educational and his social and his class related conditions, because we know that there are several barriers. Right. So the state of illness doubt, as explained by Akram, is situated between the states of illness and sickness. Illness doubt, for the present author, refers to a situation of an ill person in which symptoms and sufferings caused by a disease is prevalent, and suffering is realized by the person. But the state of sickness is not realized because of lack of diagnosis or failure of social relations or social capital or other agencies in observing or noticing the situation, or inability of the individual to declare. That means it is the responsibility of the individual to make a declaration. If the individual is not declaring about his problems, then the illness will not get converted into sickness, or it will be the responsibility of the near and dear, or you can say the social capital, to observe. If the near and dear cannot observe, the social capital has failed to observe, then the matter cannot get reported. And if, say, the matter is reported to the health providers, but may not be understood well, may not be taken well because of lack of those illness narratives or illness reconstruction, even then the doctor will fail to understand. The doctor may say, okay, fine, there's no problem, right? And under those conditions, the person remains in the same state, goes back to the state of illness. But the problem is there, and the status is not getting changed into another one, that is the sickness. It creates some kinds of doubts in the mind of that person, and I have identified this as illness doubt. And basically this is something which is based on my own empirical observations and findings. I conducted 2 studies. One, during my doctoral work, I worked with the tribal population in Rajasthan, and I realized that many people cannot start the process of seeking treatment because they have some kind of doubts in their mind. Okay, is this an ailment? No, there is no. It doesn't seem to be an ailment. So sometimes self-doubts are there, that no, I think it's not a problem that needs to be reported, right? Or sometimes when the report, the people say, oh, what a funny thing you're talking about. This is not a problem. This should not be reported. Doctors are not uh, waiting for observing these kind of conditions. So if these conditions if these conditions occur frequently, then that creates kind of illness doubt. And next time when the person is witnessing that problem, he thinks over this, and then he is not reporting because the symptoms are not very sharp. And over a period of time, when the symptoms become very observable, very sharp, then the ailment has already reached to a higher level. I'm talking about causation of several serious kinds of disease, right? So during that stage, during my own field work, I observed this. And then later on, I was working with the migrant workers, and I witnessed a similar thing, that the migrant workers, because of their movement from one place to another place, and because of the change of the social context and the cultural and several other things, again, they are witnessing some kind of problem, but they are reporting it to the medicine shop owners or maybe the quacks. And they are saying that, okay, no, it's not a problem. Okay, just take this medicine and you will recover from all those problems. So when that problem is occurring again, then the person is having some kind of doubts. So this is a state of illness doubt. And for a proper handling of this situation, basically we need to improve this illness narrative and narrative reconstruction. And there is one more term that I have not included here, that is the medical narrative, right? Or medicinal narratives, because narrative medicine, right? Narrative medicine, because medical science has established that narratives are important component of medicine. So if this narrative is expressed well, it can work as medicine, right? Because it helps in enhancing the process of fastening the process of seeking treatment, kind of thing. So all these things are involved. I hope by now I have made it clear to all of you that illness and sickness are two very important conditions in seeking healthcare. The departure from the condition of disease to reaching to the condition of treatment or seeking medical care is actually not very smooth, and all social conditions are actually embedded here. Now, this whole thing is understood sociologically, and as I stated earlier, there are different sociological perspectives. At least 5 perspectives I can count here: the functional perspective, the Parasonic Functionalism, Symbolic Interactionism, Marxist theory, Feminist theory, and Foucauldian theory. Let me very briefly tell what do they say. Basically, the Parasonic Functionalism looks at the role of sick person plays in the society. The focus is on how being ill is given a specific form in human society so that social systems stability and cohesion can be maintained. Functionalists are concerned with stability and cohesion of the social system. So when somebody is becoming sick or ill, Parsons says that it is the responsibility of the society to take care of the recovery trajectory. And that is why Parsons talks about sick role and talks about the state of sickness. Because for Parsons, if an individual is moving from the condition of illness to sickness, then it becomes the responsibility of the society to take care of. If the condition is moving from illness to sickness, then this person should be identified in sick role, and the sick role is actually giving certain rights and responsibilities. Now it is the responsibility of the society. Symbolic interactionism, as we talked about it even earlier, they talks about the interaction. So what happens between the patient and the doctor, or you can say what happens when a person is first time witnessing the problem and reporting the matter to someone else. There are so many things. Everything is located socially within the social conditions. Then the Marxist approach. Well, Marxist approach is talking about the capitalist mode of production. A Marxist approach is very clear about all these things. Says that disease causation is actually a social process, and if we witness the kind of disease that we are witnessing in contemporary society are caused because of the capitalist mode of production. This is their main argument. And then We can talk about these things at a later stage. Then Marxist approach is also talking about the income factor or the affordability factor. So for them, the economic factor is the primary factor. Then the feminist theory, feminist perspective, of course, they talk about the gendered nature of definition of illness and treatment. We took some examples from this perspective even earlier. We talked about the status of women. Because illness and sickness depend upon the social conditioning. So if a particular category, say women, are unprivileged, then certainly the problems they are reporting may remain underreported. Now let me tell you, women in India are witnessing the problem related to anemia, right? Even the middle class women are witnessing the problem related to anemia. Now, middle class women means the affordability issue is not there, or even the availability issue is not there. But despite having availability of resources and affordability of resources, the prevalence of anemia, which in itself is the root cause of several other problems, it shows that some kind of discrimination is there, some kind of deprivation is there. This is what the feminist approach is talking about. And then the Foucauldian approach, which talks about several other things. Foucauldian theory concentrates on the dominant medical discourse, which has constructed definitions of normality, health, and deviance, sickness. The discourse provides subjects in modern societies with the vocabulary through which their medical needs and remedies are defined. The source and beneficiary of this discourse is the medical profession. Medicine is not just about medicine as it is conventionally understood, but also about wider structures of power and control. So actually, Foucault is talking about power, talks about medical gaze, it talks about surveillance, it talks about the excessive power that the medical professionals are enjoying, and it talks about the kind of dependency that people have in identifying the states of illness and sickness, because there's a power equation. There's a power equation, right? We need to understand when the social system is supported by a kind of power structure, then certain problems or certain elements, or you can say certain problems which are existing with certain group of people may not be identified as a problem, whereas certain problems which may not appear to be a problem may be identified as a problem. I hope you can understand this. During the COVID times, we have understood these things at a more intensive level. So basically, this Foucauldian perspective is giving a together new dimension to the whole problem and situation. We have already came to the last slide. Here are the references and the recommended readings. I hope by now you have understood the concepts of illness and sickness and other related concepts of illness behavior. Now we'll move to other concepts. Primarily, the next lecture will be on emergence and growth of sociology of health as a discipline. So the first three lectures, first one was on health, second one on disease, and this third one on illness and sickness behavior. These are actually dealing with the basic concepts. We'll talk about these situations time and again. So I suggest you, if you have not understood these concepts well, then you watch these lectures again and understand these concepts, because once we move to the next topic or other topics, then a basic understanding of these concepts will be very necessary. So thank you very much. If you have not subscribed my channel, do subscribe so that you get information about the new lecture. And my students, they should prepare their assignments well, and if they have questions, then we will have certainly very intensive discussion. And before I close, I must say that, well, if there is some problem in this presentation, then please do point them out. I'll try to correct them in my next presentation. Thank you very much. Have a nice time. And I'm going to close this recording.